Hello, everyone. I'm Dr. James Hartley, and if you're over 60, this message is especially for you. Our hearts are miraculous engines, beating over 100,000 times a day, pumping life through every cell in your body. But with age, our heart becomes more vulnerable, not just from genetics, but from daily habits we often overlook. So today, I'm giving you a cardiologist's warning. These are the 10 heart-damaging habits seniors must stop right now to avoid heart attacks, strokes, and sudden cardiac death. Stick with me, because the last 3 habits are the most dangerous, and sadly the most common in people over 65. 1. Skipping breakfast, the silent strain on your heart. Let me be blunt with you. Skipping breakfast might seem harmless, even practical if you're not feeling hungry in the morning. But for older adults, it could quietly be pushing your heart closer to danger. As a heart doctor, I've seen it far too often. Patients over 60 come in with fatigue, rising blood pressure, or cholesterol issues, and when we dig into their daily routine, one common habit pops up. They regularly skip breakfast. You see, your body needs a steady supply of energy, especially in the morning. After a long night of fasting, your blood sugar is already low. If you don't eat, your body compensates by releasing stress hormones like cortisol and adrenaline to keep you going. Over time, this can raise your blood pressure, strain your arteries, and even lead to insulin resistance, a dangerous path toward heart disease and type 2 diabetes. In fact, multiple studies have shown that adults who skip breakfast are at a higher risk for heart attacks and atherosclerosis, which is the hardening of arteries. One study published in the Journal of the American College of Cardiology found that people who routinely skip breakfast had a more than 80% higher risk of dying from heart-related causes compared to those who made breakfast a habit. Now, here's what I recommend. You don't need a grand buffet to protect your heart. A simple, balanced breakfast will do. Think oatmeal with berries, whole grain toast with avocado, or a boiled egg with fruit. The key is to eat something within the first 2 hours of waking to help regulate your metabolism, support your blood vessels, and keep your heart on a stable rhythm throughout the day. So if you're skipping breakfast because you're in a hurry or because your appetite has changed with age, it's time to make a shift. Your heart doesn't take breaks, and neither should you when it comes to fueling it properly. 2. Sitting too much. The hidden heart killer in your living room. Now let's talk about something that seems harmless, even relaxing, but is actually one of the most dangerous daily habits for your heart after 60. Sitting too much. You might think, I'm retired, I deserve to rest, or I'm not running marathons, but I move around the house. But here's the truth. Prolonged sitting is a silent saboteur, especially for older adults. And I'm not exaggerating. Here's what happens behind the scenes. When you sit for long periods, watching TV, reading, or just resting in your favorite chair, your blood flow slows down. Your muscles are inactive, which causes your metabolism to stall. Over time, this can lead to higher cholesterol, elevated blood pressure, and blood sugar spikes, all major contributors to heart disease and stroke. And it gets worse. Research published in Circulation, a leading medical journal, found that people who sit for more than 6 hours a day have a significantly higher risk of dying from cardiovascular causes, even if they exercise later. Yes, even if you take a daily walk, it doesn't fully erase the damage of sitting for hours on end. That's how powerful and dangerous this habit can be. But the good news? You can fight back, and it's easier than you think. Set a timer to stand up every 30 to 45 minutes. March in place, stretch your legs, or take a quick walk around the room. If you're watching TV, stand during commercials. If you're reading, place the book on a high surface and read while standing for a few minutes. Small movements, done consistently, reactivate your circulation, boost oxygen flow, and lighten the load on your heart. Remember this. Your heart was made to support a moving body. Sitting for hours is like asking your heart to work hard with one hand tied behind its back. So the next time you catch yourself glued to a chair, make it a rule. Move your body, protect your heart. It's not about becoming an athlete. It's about respecting your circulation and giving your heart the support it needs to keep you strong and independent. 3. Not drinking enough water the silent drain on your heart's strength. This next habit is one of the most overlooked, yet it can quietly wear down your heart every single day, especially after the age of 60. I'm talking about not drinking enough water. Now, you might be thinking, I'm not thirsty, so I must be fine. But here's a critical truth that too many seniors don't hear. By the time you feel thirsty, you're already mildly dehydrated. And chronic low-level dehydration puts stress on nearly every part of your body, especially your heart. You see, your heart is essentially a muscular pump. Its job is to push blood through more than 60,000 miles of blood vessels. That blood is over 90% water. When you're not properly hydrated, your blood becomes thicker and more viscous. As a result, your heart has to work harder to circulate it. This can raise your blood pressure, increase your risk of blood clots, and make your heart's workload heavier than it needs to be. For someone over 60, whose heart muscle may already be under age-related stress, this can accelerate fatigue, irregular heartbeat, and even heart failure in extreme cases. But that's not all. Mild dehydration also affects your electrolyte balance, things like sodium and potassium. When these levels shift, it can cause arrhythmias or irregular heartbeats, especially in older adults who take medications like diuretics or blood pressure pills. So how much water should you drink? A general rule for older adults is 6 to 8 cups of fluids a day, unless your doctor has placed you on fluid restrictions. And remember, not all fluids are equal. Water is best. Herbal teas, broth-based soups, and water-rich foods like cucumber or watermelon can help. But coffee and alcohol don't count. In fact, they can dehydrate you further. Try this simple habit. Start your day with a glass of water and drink a small amount with each meal. Keep a water bottle nearby. If your urine is pale yellow, you're likely on the right track. If it's dark, your heart is probably working harder than it needs to. So the next time you wonder, why do I feel tired, foggy, or dizzy? Check your hydration. It might just be the missing piece that helps your heart feel lighter, stronger, and more supported. Water isn't just for quenching thirst. For your heart, it's liquid life. 4. Sleeping poorly, the hidden heart risk that strikes at night. Let's move on to a habit that silently chips away at your heart's health while you're lying in bed: sleeping poorly. Now, many seniors shrug off bad sleep as just part of aging. But here's what most people don't realize. Your heart does some of its most important recovery work while you sleep. And if you're tossing, turning, or waking up frequently, your heart never gets a break. During deep sleep, your heart rate and blood pressure drop. This gives your cardiovascular system a chance to rest and repair. Think of it like a pit stop in a long race. If the car never pulls in, eventually it breaks down. But when you get poor sleep, less than 6 hours a night, or broken, restless sleep, your heart stays in a state of stress. Your body pumps out more cortisol, a stress hormone that raises blood pressure and inflammation. Over time, this creates the perfect storm for high blood pressure, heart disease, and even stroke. And there's more. Poor sleep is directly linked to conditions like atrial fibrillation, coronary artery disease, and insulin resistance, which affects your metabolism and blood sugar, all of which place extra strain on your heart. One common but dangerous issue among older adults is sleep apnea, where your breathing stops briefly during sleep. This deprives your heart and brain of oxygen, often without you even knowing it. People with untreated sleep apnea have a much higher risk of heart attack, heart failure, and sudden cardiac death, even if they appear healthy during the day. So what can you do? Stick to a sleep schedule. Go to bed and wake up at the same time every day. Yes, even weekends. Limit caffeine and alcohol in the evening. Keep your bedroom cool, quiet, and dark, like a cave. Avoid screens for at least an hour before bed. The blue light tricks your brain into thinking it's still daytime. And if you snore loudly or feel exhausted even after sleeping, talk to your doctor. You may need a sleep study to check for sleep apnea. Here's the bottom line. If you're over 60, getting 7 to 8 hours of quality sleep each night is not just about feeling refreshed. It's about giving your heart the recovery time it needs to keep you alive and well. Remember, you can't heal in a body that never rests. 5. Ignoring stress, the silent pressure that wears down your heart. Now let's talk about something you can't see on a blood test, but it might be doing more damage than high cholesterol: chronic stress. If you're over 60, stress doesn't always look the same as it did when you were younger. You may not feel panicked or overwhelmed. Sometimes it's just a quiet tension, a constant background noise of worry. Maybe it's about your health, finances, loneliness, or even watching the news. But here's the problem. Your heart feels every ounce of that stress. You see, when you're stressed, even mildly, your body goes into fight or flight mode. It pumps out hormones like cortisol and adrenaline. Your heart rate increases, your blood vessels tighten, your blood pressure spikes. In small doses, that's not dangerous. But if you're under chronic stress, day in and day out, your body stays in a state of emergency, and that's when things go south. Studies show that chronic stress raises your risk of high blood pressure, atherosclerosis, hardening of the arteries, heart attacks, irregular heartbeat, arrhythmia, even sudden cardiac events, especially in older adults. And here's the kicker. Stress doesn't just affect your heart directly, it also affects your habits. When you're stressed, you might eat more junk food, skip exercise, drink more alcohol, or sleep poorly. All of these behaviors make the problem worse. There's even a condition known as broken heart syndrome, officially called stress-induced cardiomyopathy, where severe emotional stress can cause sudden heart muscle weakness, chest pain, and shortness of breath. It mimics a heart attack, and yes, it's real, especially in seniors who've experienced a major life change or loss. So what's the solution? You can't eliminate stress completely, but you can learn to manage it in heart-healthy ways. Try deep breathing for just 2 to 5 minutes a day. Inhale slowly through your nose. Hold. Exhale through your mouth. Practice gentle exercise like walking, stretching, or Tai Chi. Stay connected with people you trust. Loneliness magnifies stress. Limit your exposure to negative news or toxic conversations. Consider journaling or prayer if it helps you release what's inside. And don't be afraid to talk to a mental health professional, even if you've never done it before. It's not weakness, it's smart heart medicine. Here's the bottom line. Stress that stays inside your mind will find its way into your heart. If you ignore it, it will grow. But if you face it, talk about it, and gently work through it, your heart will thank you. 6. Overusing salt. The flavor bomb that slowly bombs your heart. Now I want you to picture something. You're sitting at the table. Your meal looks good, smells even better. But before you even take a bite, you reach for that salt shaker. Just a quick shake or two. Seems harmless, right? But for many seniors, that automatic habit is doing more damage than they realize. Let's be clear. Your body needs sodium, just not too much. And that's where the problem lies. When you consistently consume too much salt, here's what happens. Your body holds on to extra water to dilute the sodium. That extra fluid increases the volume of blood flowing through your vessels. More blood volume equals more pressure against artery walls. Result? High blood pressure, also called hypertension, and high blood pressure is one of the top risk factors for heart failure, heart attacks, strokes, kidney damage, even cognitive decline. Now here's the twist. Most people don't realize how much salt they're eating. You might not be dumping spoonfuls into your food, but prepackaged meals, canned soups, deli meats, pickles, and even bread often contain hidden sodium levels that go way beyond healthy limits. The American Heart Association recommends no more than 1,500 milligrams of sodium per day for adults over 60. That's less than 1 teaspoon of salt total, all day. But most older adults eat twice that amount or more without knowing it. Even if you don't feel any different right away, the pressure builds up quietly. That's why hypertension is called the silent killer. So what can you do? Start reading labels. If a food has more than 140 milligrams of sodium per serving, it's not truly low sodium. Cook more meals at home using fresh ingredients. Flavor your food with herbs, garlic, lemon juice, or spices instead of salt. Drain and rinse canned vegetables and beans to remove excess sodium. Ask for low sodium options when dining out. And if you're already taking blood pressure medication, don't let it lull you into a false sense of security. Pills can help, but if you keep pouring salt into your system, you're working against the very medicine that's trying to protect you. Here's what I tell my heart patients. Salt makes food taste better, but less salt lets your heart live longer. It's a trade-off worth making. 7. Drinking alcohol. Too often, the social habit that quietly wears down your heart. Let's talk about something a little uncomfortable. You might not see yourself as a heavy drinker. Maybe it's a glass of wine with dinner, a beer while watching the game, a cocktail during a weekend gathering. It's social, it's relaxing, it's part of the routine. But when that routine becomes daily or excessive, it turns into a silent threat to your heart health. Here's the truth many seniors don't hear enough. Even moderate drinking can have long-term effects on your cardiovascular system, especially as you age. Why? Because your body processes alcohol differently after 60. Your liver slows down. Your body has less water to dilute the alcohol, and your medications, whether for blood pressure, diabetes, or sleep, can dangerously interact with alcohol, amplifying its effects. Let's break down what regular alcohol use does to your heart. Raises blood pressure. Alcohol stimulates your nervous system and causes your heart to beat faster, increasing pressure on artery walls. Triggers irregular heart rhythms, including atrial fibrillation, which dramatically increases the risk of stroke. Weakens the heart muscle over time, leading to a condition called alcoholic cardiomyopathy, where the heart can't pump efficiently. Promotes weight gain, especially belly fat, which is closely linked to heart disease. Can increase triglycerides in the blood, a type of fat that raises the risk of clogged arteries and heart attacks. And here's a warning sign you shouldn't ignore. If alcohol is your daily stress relief, your nightcap, your reward, it may be doing more harm than good. The American Heart Association and CDC both recommend no more than 1 drink per day for women and 2 for men. And even that may be too much for seniors with heart conditions or on medication. So what can you do instead? Replace your evening drink with something that still feels like a treat. Sparkling water with lemon or a non-alcoholic wine or beer. Practice relaxation techniques like deep breathing, a warm bath, or calming music instead of reaching for the bottle. Talk to your doctor honestly about your drinking. There's no judgment, just a chance to protect your health. Here's the key idea I give my senior patients. Alcohol doesn't need to be forbidden, but it must be respected. The heart gets more fragile as we age. Let's not burden it with toxins it can no longer handle like it used to. 8. Ignoring dental health. The hidden heart risk in your mouth. Let me ask you a question most doctors won't. When was the last time you visited the dentist? Not for a toothache, but for a checkup. You see, most people don't think about their gums and teeth when talking about heart health. But for seniors, ignoring dental care could be silently damaging your heart day after day. Let me explain. Your mouth is full of bacteria, most of it harmless. But when you don't brush and floss regularly or skip cleanings, that bacteria builds up. It causes gum inflammation, which leads to periodontal disease. Here's where things get serious. That inflammation doesn't stay in your mouth. It spreads into your bloodstream, triggering a constant low-level immune response, the kind that damages artery walls and accelerates plaque buildup. In fact, studies from the American Heart Association and Harvard School of Public Health have shown a strong link between gum disease and atherosclerosis, the hardening and narrowing of arteries, increased risk of heart attacks and strokes, poor blood sugar control in people with diabetes, which further strains the heart. Here's a simple story I often tell. I once had a patient named Helen. She was 72 and had never had heart issues until one day she experienced chest pain. Turns out she had undiagnosed gum disease for years. Her cardiologist and dentist both agreed. The inflammation from her gums had quietly contributed to her cardiovascular trouble. And this isn't rare. In fact, if your gums bleed when you brush, if you have chronic bad breath, if your teeth feel loose, your mouth may be sending warning signals. So what should you do? Brush twice a day with a soft toothbrush and fluoride toothpaste. Floss daily even if your teeth feel fine. It's about cleaning between the gums. Use antibacterial mouthwash to reduce harmful microbes. And most importantly, visit the dentist twice a year, even if you wear dentures or have few teeth left. Think of it this way. Your mouth is the front door to your body, and your heart listens to what's going on there. Protecting your smile might just protect your life. 9. Taking the wrong medications together. A silent danger lurking in your medicine cabinet. You might be surprised to learn that some medications you take daily, even those prescribed by different doctors, can interact in ways that harm your heart and overall health. Especially after 60, many seniors are prescribed multiple medications for various conditions. This is called polypharmacy, and while it's often necessary, it also increases the risk of dangerous drug interactions. Let me share a story. Mr. James, 68, was on several medications for blood pressure, cholesterol, and arthritis. One day he started feeling dizzy and his heart was racing. After a thorough check, doctors found that 2 of his medicines were not compatible. They amplified each other's side effects, putting unnecessary strain on his heart. Here's what happens. When certain medications mix, they can cause unexpected side effects like irregular heartbeat, arrhythmias, dangerous drops or spikes in blood pressure, increased risk of blood clots or bleeding kidney or liver damage, which indirectly affect heart health. Some common offenders include mixing blood thinners with painkillers or certain cholesterol medications with antibiotics. What makes this problem worse is that many seniors take over-the-counter supplements or herbal remedies without telling their doctor. Some medications need to be taken with or without food. Mixing this up can alter how the drug works. Different doctors might not be fully aware of all the medications you're on. So how can you protect yourself? Keep an updated list of every medication and supplement you take, and share it with every healthcare provider you see. Ask your pharmacist to review your medications regularly for possible interactions. Never stop or start a medication without consulting your doctor. Use one pharmacy if possible so they can track all your prescriptions. Your medicine cabinet should be a tool for health, not a hidden hazard. By staying informed and proactive, you can avoid the dangerous pitfalls of medication interactions and keep your heart strong and steady. 10. Ignoring heart symptoms. The warning signs you should never overlook. After 60, your heart sends you signals when something's wrong. But many seniors either don't recognize these signs or dismiss them as just aging. This can be a dangerous mistake because ignoring heart symptoms can lead to serious, even life-threatening problems. Here's the truth. Your body is trying to communicate with you. Symptoms like chest discomfort or pain, shortness of breath, especially during activity or even at rest, unexplained fatigue that lasts longer than usual, dizziness or lightheadedness, irregular or very rapid heartbeat, swelling in the legs, ankles, or feet. These aren't just minor annoyances. They can be early warning signs of heart disease, heart failure, or arrhythmias. Take Mrs. Linda's story. Linda, 72, often felt tired and occasionally had chest tightness, but she brushed it off as stress or old age. One day she collapsed due to a heart attack, something she could have potentially prevented if she had listened to her body sooner and sought medical help. What you need to do: never ignore persistent or severe symptoms. Even if the pain is mild or intermittent, report it to your doctor. Don't wait for symptoms to become unbearable or for a family member to insist you get checked. Keep a log of symptoms, when they happen, how long they last, and what you were doing. Seek immediate medical attention if you experience severe chest pain, sudden shortness of breath, or fainting. Remember, early detection saves lives. By paying attention to your heart's warning signs and acting quickly, you give yourself the best chance to stay healthy, active, and independent for years to come. You don't need to be perfect. You just need to be aware. Small changes to your habits today can prevent heart attacks, hospital stays, and even early death tomorrow. Your heart is talking. Are you listening? I'm Dr. James Hartley. And if you found this video helpful, hit that subscribe button and share it with someone you care about. Which of these 10 habits are you ready to break today? Tell me in the comments. I read everyone.